Thank you, Lasceann Corla, and thank you for the opportunity to bring this issue to the attention of the House and the Minister. I'd like to thank Minister Butler for stepping in on behalf of Minister Donnelly, whose area this is. The Dental Treatment Services Scheme, the DTSS, provides access to dental treatment for adult medical cards holders aged 16 or over. Medical card holders are entitled to a free dental examination in each calendar year, as well as any extractions that are required along with a number of other services. And last November it was reported that the number of private dentists participating in this scheme had dropped by 16%, from 16,054 to 13,093 in the 10 months from January to October 2020. That's a large percentage of a reduction. It was estimated that about 200,000 medical card holders are facing delays for treatment as a result. On foot of these alarming reports, I've submitted a PQ to the Minister for a breakdown of the number of dentists per local electoral area in County Wexford. The response said that there were 10 dentists in Wexford Town and 4 in New Ross. Unfortunately, based on the following correspondence, it seems that those figures from last November may have worsened since. And I quote an email from a constituent. "Dear Verona, my dentist informed me that they have stopped treating medical card users and to contact Grogan's Road for further information. They told me that 4 dentists in Wexford and none in New Ross were still in the scheme. However, when contacted, they all told me they had left the scheme. I am a pensioner in my 70s, taking warfarin, which needs regular dental checks, free under the scheme, and I now face heavy fees. Is there any hope that there will be a dental medical scheme any time in the future?" So it appears, therefore, that in the space of 8 months, Lasceann Corla, from last November, the number of dentists in the scheme from just 2 local electoral areas in County Wexford has reduced from 14 to 4. And that's pretty alarming. So I hope that the Minister can confirm whether these figures are correct and what steps will be taken to address the issue as to why so many dentists are now finding it unfeasible to continue in the scheme. I understand, Lasceann Corla, that the Irish Dental Association have met with the Department of Health officials to discuss their concerns. So I'm asking the Minister for her response to outline if anything has happened as a result of those discussions and what solutions have been proposed. Thank you.
Minister Butler.
Deputy Murphy, thank you very much for raising this really important issue, and I welcome the opportunity to address the issue of the current difficulties in the Dental Treatment Services Scheme. The Dental Treatment Services Scheme provides dental care free of charge to people with medical cards aged 16 and over. These services are provided by independent dental practitioners who have a contract with the HSE. Patients may choose to have their treatment undertaken by any dentist who participates in the scheme. I am aware there has been a reduction in the number of dentists participating in the scheme since the beginning of the COVID pandemic. HSE figures indicate that up to the end of April 2021, approximately 213 dentists have left the scheme or have notified the HSE of their intention to leave the scheme. Of those, approximately 27 have left or have notified the HSE of their intent to leave between January and the end of April 21, with 112 applications for new contracts being processed. But to answer your question directly, there are approximately 1,200 contracted dentists at present, with approximately 700 claiming per month. Some people have been experiencing problems in accessing dental services close to their home as a result of dentists leaving their DTSS, and I believe there's probably not a TD present in the House that isn't aware of it. However, the HSE has assured the Department of Health that their local service on the ground will assist any individuals who are experiencing problems in accessing a service. So officials in the Department of Health have been engaging with the Irish Dental Association since the start of the pandemic. My colleague, the Minister for Health, met with the IDA representatives in November 2020 to discuss their concerns, and he addressed their annual conference last month. The Minister has asked officials in the department to work with the HSE and the Irish Dental Association to develop solutions that will ensure the sustainability and viability of the scheme. The Minister is committed to ensuring that all eligible persons should continue to receive the services that they deserve from their local dentist of choice. The further provision of oral healthcare services will be informed by the National Oral Health Policy, Smile agus Sláinte, which was published in 2019. It includes proposals for the introduction of packages of oral healthcare for adults with medical cards at different intervals during their life course. The packages will focus on preventative dental services. Routine care, including additional fillings and complex care, will continue to be available in addition to the preventative packages of care. The Minister is committed to ensuring that sustainability and viability of the scheme. It will need to be revised to align with up-to-date best practice and evidence. This will mean, and I think this is a really important part, this will mean moving away from symptom-led attendance as an emergency focus to encouraging attendance for preventative care and the provision of evidence-based oral health care tailored to each individual's needs. There was an intention to commence a review of the contract between dental practitioners and the HSE last year. Unfortunately, due to the pandemic, this was not possible. However, the Minister has asked officials in the department to engage with the Irish Dental Association to commence this process. A meeting between the department, the HSE and the Irish Dental Association is being organised for next week, and the Minister is confident that progress will be made in resolving the current difficulties.
Thank you, Minister. Deputy Murphy.
Thank you, Minister, and thank you, Last Count Corla. I'm heartened to hear that, because I do believe that this is quite an urgent matter. As you heard in the email I read out from one of my own constituents, ultimately the man is in his 70s and had been working and has now received his medical card for over 70. But it's of no benefit if he's unable to get an appointment. Now, I hear what you're saying, Minister, in relation to the IDA as well as the Minister, but apart from the Minister asking his officials to engage, I would really expect that the level of dentists leaving the scheme is absolutely astounding, and I think the Minister should be engaging directly to make sure that this isn't eroded further, or we're going to have a very serious crisis on our hands. I have the same situation when it comes to doctors, not with medical cards, but I find that many of my constituents are emailing me complaining that they cannot actually access the doctor, either as a private patient, whether they've moved into the area. One man recently telling me he lives in my area and has to return to Navan for a standard GP visit. So in this regard, this gentleman has warfarin. It is not someone who is going at the last minute. He needs regular dental checkups. And equally, there are anybody now going for medical procedures or operational procedures in our hospital healthcare system actually have to visit the dentist before they will be given an anaesthetic. And that isn't always someone who can pay for the service. They may well be under the medical card scheme and the DTSS scheme. So, Minister, I know that you will go back certainly and report to the Minister the urgency of the matter and that the detrimental effect it will have if it's to continue to be eroded in this vein. And last Count Corley, if you permit me, I'd just also like to ask the Minister very quickly to consider speaking with NIAC and the rollout of the vaccine for the second jab of those who are 60 in the 69 to 60-year-old cohort. I think it's primary to the protection of those in a vulnerable age category in relation to the Delta variant that we do that as soon as possible. Thank you.
The Minister.
Gaurav Mahagut, to answer you the second part of your query first, that is ongoing and something that I'm very, very much aware of. So just to conclude again, as I've said, Minister Donnelly did meet with the Irish Dental Association last November, and he spoke at their conference last month and is acutely aware of the challenges. We have discussed it. I'm just looking here, and the reason why some of the dentists are saying they're leaving the scheme is they have been seeking a review, including increases in fees for a number of years. There has been significant changes in dental practice since the current contract was agreed, particularly over the past decade, including new radiographic standards, new technology and higher standards in infection prevention and control, which has added to the costs of running a practice. Dentists also claim the costs associated with the current COVID-19 pandemic, including the additional costs of PPE, social distancing of patients and staff being less available, have placed an additional burden on dental practices. There is no doubt about it, the Smile Agus launch of the National Oral Health Policy provides the guiding principles to transform our current oral healthcare service over the next 8 years. But I do look forward to the impending meeting next week between the HSE, the department, and the Irish Dental Association, because it is imperative that people can get that care when they need it. As we all know, the worst pain you can ever have is a toothache. And I do look forward to a stage that we aspire to, that we move away from symptom-led attendance and an emergency focus to encouraging attendance for preventative care. And I'll be happy to update you when we've more information. Thank you very much, Deputy.